If you suffer from depression or seasonal affective disorder, Wellbutrin XL 150 mg 24-hour tablet, an extended-release antidepressant, may be prescribed to you. This medication can help improve your mood and overall sense of well-being by balancing certain natural substances in the brain, such as dopamine and norepinephrine. It is important to take this medication as directed by your doctor, typically once a day at the same time each day. It is usually best to take it in the morning to avoid potential sleep disturbances. Before taking Wellbutrin XL 150 mg 24-hour tablet, extended-release antidepressant dopamine norepinephrine reuptake inhibitors, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning. If you have stomach upset, you may take this medication with or after a meal or snack. Taking this medication late in the day may cause trouble sleeping, insomnia. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Swallow the tablets whole. Do not crush or chew the tablets. Doing so can release all of the drug at once, increasing the risk of side effects. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not stop taking this medication without consulting your doctor. Your dose may need to be gradually decreased. It may take 4 weeks or longer before you get the full benefit of this drug. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Wellbutrin XL 150 mg 24 hours tablet may include dry mouth, sore throat, dizziness, nausea, vomiting, ringing in the ears, headache, decreased appetite, weight loss, constipation, trouble sleeping, increased sweating, or shaking, tremor. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. You may notice an empty tablet shell in your stool, but this is harmless as your body has already absorbed the medication. It's important to remember that this medication has been prescribed to you because the benefit is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Wellbutrin XL 150 mg 24 hours tablet may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. If you experience any serious side effects such as fast/pounding/irregular heartbeat, mental/mood changes, unusual weight loss or gain, seizure, eye pain/swelling/redness, widened pupils, or vision changes, seek medical help right away. A serious allergic reaction to this drug is rare, but if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Bupropion hydrochloride, HCl, is an antidepressant used for smoking cessation and to treat a variety of conditions, including depression and other mental/mood disorders. Antidepressants can help prevent suicidal thoughts/attempts and provide other important benefits. However, a small number of people, especially people younger than 25, who take antidepressants for any condition may experience new or worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts. It is very important to talk with the doctor about the risks and benefits of antidepressant medication, even if treatment is not for a mental/mood condition. Be sure to tell the doctor right away if you notice new or worsening depression/other psychiatric conditions, unusual behavior changes, including possible suicidal thoughts/attempts or other mental/mood changes, including new/worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings, impulsive actions, severe restlessness, very rapid speech. Be especially watchful for these symptoms when a new antidepressant is started or when the dose is changed. If you are using bupropion to quit smoking and experience any of these symptoms, stop taking it and contact your doctor right away. Also, tell your doctor right away if you have any of these symptoms after stopping treatment with bupropion. Remember to take your medication as prescribed and at the same time every day for best results. Before taking Wellbutrin XL 150 mg 24-hour tablet, extended-release antidepressant dopamine norepinephrine reuptake inhibitors, it is important to inform your doctor or pharmacist if you have any allergies or if you are currently taking any other medications. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's essential to discuss this with your healthcare provider. It's also important to disclose your medical history, especially if you have diabetes, heart disease, high blood pressure, kidney problems, liver disease, a history of drug or alcohol abuse, seizures, or conditions that increase your risk of seizures. Additionally, if you have a personal or family history of glaucoma, it's important to inform your doctor or pharmacist. It's important to note that this medication should not be used if you are suddenly stopping the regular use of sedatives, drugs used to treat seizures, or alcohol, as this may increase your risk of seizures. This medication may cause dizziness, and it's important to avoid alcohol or marijuana, cannabis, as they can increase this effect. It's also advised to avoid driving, using machinery, or anything that requires alertness until you can do so safely. If you are using marijuana, cannabis, it's important to discuss this with your doctor. Alcohol can also increase your risk of seizures, so it's important to avoid alcoholic beverages. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, they may be more sensitive to the side effects of this drug, especially dizziness and memory loss, which can increase the risk of falling. During pregnancy, this medication should only be used when clearly needed, as untreated mental/mood problems can be a serious condition. It's important not to stop taking this medication unless directed by your doctor. If you are planning to become pregnant, are pregnant, or think you may be pregnant, it's important to discuss the benefits and risks of using this medication with your doctor. This drug can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Wellbutrin XL 150 mg 24-hour tablet. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Wellbutrin XL 150 mg 24-hour tablet are codeine, pimozide, tamoxifen, thioridazine. Avoid taking MAO inhibitors, isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, tranylcypromine, during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before and after treatment with this medication. Ask your doctor when to start or stop taking this medication. Also, be aware that this medication may interfere with certain medical/lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, do not hesitate to call for emergency help. In the United States, you can reach your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of overdose may include seizures, severe confusion, hallucinations, rapid heart rate, and loss of consciousness. It's important not to share this medication with others, as it is prescribed specifically for you. Your doctor may also require you to undergo lab or medical tests, such as blood pressure or liver function tests, while you're taking this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Do not take extra to make up for the missed dose. Remember to take it at the same time each day to keep the level of medication steady in your body. It's important to store your Wellbutrin XL 150 mg 24-hour tablet at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this safely. As a reminder, always take medication as directed by your healthcare provider and follow their instructions for storage and disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.